says we're waiting for her to approve it. Look at that.
Oh my God, we did it.
It worked.
Yay, I'm so happy.
All right. Anne has a practice in Austin. She's really good at mold and toxic metals and does like some concierge stuff probably for people you've heard of. And tell us what happened when one of your patients got coronavirus. So we want to know symptoms. We want to know what did you have to do when the hospital didn't want to give them what you thought. So
yes. So he had been, he'd come back from Chicago, and a couple days later, just wasn't quite feeling himself. And then a few more days later, he got some diarrhea. And then a few nights later, started running a fever. But he never really had significant sore throat or any symptoms in his chest. And then about 8 days later, he just started feeling like his body was hitting the wall. Like still no cough, no major chest symptoms, just hard, some pain in his body, kind of hard to function. And then
was he healthy? Like pretty darn healthy?
66 and extremely healthy. Okay. Like extremely healthy. Great lifestyle, really takes care of himself. Okay. And so I started getting, like, even though he wasn't the traditional symptoms, I was like, yeah, this is just too coincidental. So Monday night, I started him on what I had been researching. I was spending hours and hours reading through journal articles to see what I needed to add to his regimen, because we had him on some immune system support. And so I started him on the medications that I thought would be the most beneficial, which were hydroxychloroquine, which is highly controversial at this moment. And
why is it controversial? It worked in China, and now the CDC is like, wah, wah, wah. But the controversy is it medically warranted?
Absolutely not. The World Health Organization has deemed hydroxychloroquine as one of the most important drugs that we cannot run out of, because it's a very effective malarial treatment in many ways, and it's used by many people for rheumatoid arthritis and other autoimmune disorders. It's used heavily every day. Yes, give us some thumbs up. So
chemical engineer Dr. Ann Shippy just said that the whole, maybe why it's controversial, there's no reason for controversy. Why did the hospital not want to give this stuff to your patient who you had already given it to?
Yeah, because they've decided that their protocol is not going to include that. All they're going to do is give fluids. I know, look at your face, Dave. I can see how appalling this is. Very angry. So their committee decided, so I'm getting some feedback here. So their committee decided that that was not going to be their protocol, that they would just watch people on oxygen, give them some fluids, and wait and see if they needed to be intubated, basically.
So a committee told the doctors running the ER how to practice medicine. The doctors weren't allowed to do what they wanted?
Well, the committee had pharmacists, infectious disease specialists, their ICU, the pulmonary care and critical care doctors. Like it was a full-blown committee, from what I understand. This is all, I'm just piecing things together from talking to the attending physician several times, that was taking care of him. So I had sent him to a friend of mine, Dr. Hopkins, who has an ER, and he, just because his symptoms were so atypical, I knew if I sent him to the ER that he would get turned away. And so I coordinated with one of my attendings from med school and residency to see him. I told him I was pretty sure he had it, so he was very kind and was like, "Yep, I'll see him. I'll take the risk of seeing him before we know what the diagnosis was." I'd been wanting to get him tested for days, but at that time in Austin, you could only get tested if you were about to crash, and so he ran a CAT scan for him, and we could see that he had the findings on the CAT scan that are typical for having coronavirus. It's a pneumonia in the lungs. That's what really causes most people to have their severe symptoms and fatality. So since it was so highly suspicious, we sent him to this hospital. Now I would have sent him to a different one if I had known that they weren't going to give him the prescriptions. And they finally did test him. They tested him on admission and finally agreed to admit him. And so I get this call later in the afternoon from my patient, and he said they're not giving me the medication. So then I talked to
This is one you already had put him on when he was improving on it, right?
Well, no, I started him on it like an hour or two before. I was like, he's crashing. So I had given him the medicine and then called him back an hour or two later. And I just got that sixth sense that things were not good.
Okay.
And so I literally, like when I finished with my last patient, where I'm doing telemedicine these days, I just like, I was just, it was so upsetting to me. I was crying. I hadn't cried since my dad died about a year ago. And so then I called a couple people that an infectious disease specialist. I couldn't get through to her. Some other people that have more hospital experience, because I haven't been working in the hospital in over 10 years. Like, how do I handle this? So I just went for it. I escalated it to the head medical officer of the hospital, and
you're being very professional because you have all those certificates. We talked on the phone yesterday about this. You tore them a new asshole is what you did.
Well, no, by the time I actually talked to him, I had calmed down a little bit, and I just asked for his help. I just like, I feel like this patient is not going to make it if we don't continue on this medicine. And he was also looking for a win-win. Like, I have to give him credit for that. Like,
good deal.
He wasn't going to change they couldn't change his policy because that was the committee's decision, right? So he helped me find a way around it, which was for me to bring his home medication to the hospital. So I put my mask and my gloves on and took the medication over there, gave it to the security guard at the entrance of one of the COVID designated hospitals in Austin, and then coordinated with the house supervisor to get it up to the floor, which took like 2 hours. And then I didn't go to bed that night till I knew it was in his body. The nurse was amazing for helping me coordinate it and following up with me. And the amazing thing is that the following day, when by mid-afternoon, the patient, he could feel such a difference in his body. Like, he could feel like his chest felt different. The aches in his body felt different. His fever was going down. Like, he had been really ramping up, and it was really, really encouraging that, along with the high doses of vitamin C, I got the physician to do that. And
IV?
No, they didn't do IV, but
Oral.
They did give him oral.
Okay.
They didn't have an IV protocol, but at least they did the oral.
Hospitals don't do IV vitamin C. It's witch doctory.
I know, really. Actually, some of them do. There's some of them up in New York, I've heard, are doing some IV vitamin C. And then high doses of zinc, because for the medications to work, you need high doses of zinc, because it's working on the zinc mechanism that influences whether the virus can take over the cells.
Did you do a Z-Pack as well?
And yes, he got IV azithromycin, and then now we're continuing it with the oral medication. So it's, in a way, it's really optimistic because, to see it firsthand. I really don't think that there's going to be a vaccine that's safe and works based on the early vaccine data. So for people that are hanging out thinking, oh, we're going to, this is all going to clear up once we have a vaccine. I know.
I'm sorry, unless we shut down global travel forever, if you're not immune, you're going to get sick at some point. It's just how it is.
So my hope is that we have testing that we can do to identify people who have contracted the virus with very timely way, and then provide a safe medical protocol so that they can fight off the virus before it gets to be pneumonia. Right now, we're having to conserve those medications for people who do get that sick because we don't have enough supply. But many of the drug companies that make this medication are ramping up their production of it very significantly. I just read something about one of the drug companies is going to be able to very quickly make enough for over 1 million people to get this. We need multiple drug companies in multiple locations doing this. But, the fact that the drug companies are putting their resources into it, I think it says a lot about their belief in the medication working for this as well. And then we see crazy things like governors deciding that it's illegal in their states. Like that, they're not medical. It's like, to me, that's criminal that they're trying to make that the medication that may save lives not available.
Yeah, it's tyranny, honestly, when a government says doctors or just people can't use the medications that they decide, because it's not the government's role. They don't have a constitutional right to do that. It's pretty horrifying, to be perfectly honest.
Mm-hmm. So the other thing that I think is really fascinating, and that people that are in those states that are think, oh my God, I'm not going to be able to get this medication. There was a law that was passed last year that is I think it's called right to treat. So it's for people that are in critical situations where there's not good treatment options to use more investigational options. So I haven't talked to an attorney about what it would take to get that, but I think that would be the next thing to do for those people in those states. And I'm afraid we're going to have more states try to take this action. We also had a crazy thing happen here in Texas. The pharmacy board met and decided to put some restrictions on getting physicians prescribing the hydroxychloroquine. I'm getting different stories about what they were actually trying to do. When I talked to the compliance, the main person responsible for compliance for the pharmacies in Texas, he said the intention was just to keep people from stockpiling it, and so that people didn't have it sitting on their bathroom counter instead of in the ICU or in the hospital where we need it. But it was so poorly worded that many people in the medical field, I think many pharmacists are confused about what they're supposed to be doing and whether it applies to COVID-19 patients. So if you are in Texas and you're anybody medical, all the pharmacists are supposed to be doing is just making sure that either it's people who are already on the medications for their autoimmune diseases or for COVID-19 patients that have symptoms.
I have a few questions. I've been monitoring what the audience is saying as you're sharing. So one of them is our mutual friend, Queen of the Thrones, who she's really into poop. This friend of ours, she's saying that she thinks the best testing would be anal, which is totally funny. But this is a real question because it turns out coronaviruses are expressed in the gut. They last longer in poop than they do in snot. True or false?
It's absolutely true. And it kind of makes sense that all these outer surfaces on our body are contiguous, and that's the outside of, or the inside of the lungs are really out to the outside world. So all these outside surfaces that have these receptors that the viruses are attaching to, that's part of why they're so virulent. And the gut. Initially, the data was just showing 8% of patients had any digestive symptoms, but now the data is closer to 40 or 50% have diarrhea or anorexia, where they're not feeling like eating, or abdominal pain.
And this is one reason that it's no longer appropriate to poop in a bag and leave it on your neighbor's porch on fire. We must not do that anymore as part of social distancing.
But it's actually really, really important to wash your hands.
After you poop. I never have before, but I've started. So sorry. Well, I feel like JP Sears when I said that. Sorry, I was just channeling.
And let's talk about appropriate hand washing too. It's 20 seconds. Like I'm still like, we're 1, 2, like I'm trying to actually, rather than just guess how long I'm washing my hands, I'm doing a little meditative kind of count, and 1 second, 2 second, 3 second, all the way up to 20 seconds to really make sure that you're getting clean hands.
I actually, Dr. Oz, emailed out a few people on the show. I was like, I want a video shot on a cell phone of you washing your hands while singing happy birthday. I'm like, I can't sing. This is not one of my skills. So I have happy birthday. And I did. I don't know if you ever used it or not, but it was like a compilation. So, all right. Now, sing happy birthday to Oprah twice. That's the count. There we go. Thank you, Betty Rocker, i.e. Bree. Okay. Other questions. The oral dose of vitamin C, how much were you using with your patient?
I would actually use more now. I really would just take it up to bowel tolerance, whatever amount that you could take, since I couldn't give it IV. So, as many guys, grams as you can get in.
Okay, so bowel tolerance, in case you don't know what that is for vitamin C, this is something that's been used forever in orthomolecular, which became functional medicine. And that means you just take a few pills, then take a few more, until you get disaster pants. And at that point, a Queen of the Thrones just does a little dancey jig because she's like into poop and stuff. Just kidding. I had to say that. But she already said, I agree, bowel tolerance. The deal is once you're there, back off a little bit from there and keep taking that amount. So you almost have the runs. Now,
which is probably a good thing for getting the virus out of your body.
How long do you have to stay at the almost poopy stage? How many days?
I would, if you think you got COVID-19, I would do it until you have a negative test.
Yeah. Okay. So in other words, days and days. For me, if I'm not sick, I can generally tolerate about 10 grams a day in divided doses. And I'm a relatively big guy. When I get sick, like if I used to get sinus infections and toxic mold and things like that, I could take 75 grams a day and not get the runs. So when you're sick, your immune system's like, give it to me now, give it to me, everything you've got from a vitamin C perspective. So you take a lot of vitamin C if that's happening. And the idea, I'm going to take 2 grams a day. That might be somewhat protective, but once you start getting sick, it's not going to move the needle. It's an exponential sort of dosing curve or asymptotic dosing curve.
And it's really critical in this. Like I want to go, there's a research study going on in New York right now, and I want to go read their protocol, because if they're not giving vitamin C and zinc, I don't think it's going to look like it doesn't work very well, because you have to have the high doses of zinc because they've already gotten depleted in your body from fighting off the virus.
75 grams of vitamin C I was talking about. And how much zinc? Because guys, zinc could be toxic and lower your blood sugar, and too much zinc can kill you. You do not megadose zinc. What's an appropriate type of zinc and an appropriate dose of zinc?
You know, that's a really good question. I'm doing kind of a combination of an elemental throat spray that I think absorbs really well, that looks like a pretty low dose, but I think it's very bioavailable. And then also doing zinc glycinate. And again, I'm being kind of cautious with it, but if you know you're fighting coronavirus, I would go up as high as 200, 220 milligrams a day.
In one dose or per day?
I would break it up a little bit. And then, what I'm putting people on preventively is 60 to 100, depending on if I already kind of know that they're low in zinc. I run these tests where I look at nutrient values in depth. So if I know that they've been low, then we need to ramp it up from where even their baseline dosing is.
I feel like for a month or two, 100 milligrams works for most people, but I'm not a chemical engineer, medical doctor, high-end functional practice in Austin. I'm just an unlicensed biohacker. All right, people ask about brands, and I'm gonna ask you some questions and share my thoughts in the questions, because I want you to shoot me down if I'm wrong. One, you can't megadose liposomal vitamin C because so many liposomes come in that you just poop oil. True or false?
I don't find that that's the case.
75 grams? You're going to have 2 cups of lecithin.
Oh, no, 75 grams? Oh, no. Yeah, no, I wouldn't go that high. I think you have to do, if you want to do some liposomal, I think you have to do it with the other forms of vitamin C.
Okay, so we're in agreement there. Some liposomal is good, but you can't do the mega doses. And there's a persistent thing that says whole foods vitamin C, which means vitamin C extracted from whole foods is different than ascorbic acid, which is vitamin C that's usually taken out of corn.
I actually like to use a combination. So I do a little bit of liposomal and then a mix of the chemical manufactured pharmacy with some of the plant-based. I haven't researched it lately, but a few years ago, I ran across some studies that showed that vitamin C is very helpful for people that are post-stroke or for stroke prevention. And the plant-based was more effective than the synthetic vitamin C.
Yeah. Well, the synthetic vitamin C is actually still plant-based. It's made by reacting. It's made basically from bacteria eating corn. So it's the same general thing. What is going on though is the plant-based stuff isn't just vitamin C. It's vitamin C with cofactors like, drumroll, quercetin. I have my kids on 600 milligrams of quercetin a day. I'm taking 1,200 a day. Quercetin is shown in multiple clinical observations to be a really good thing against coronaviruses, not necessarily this specific one. So that's probably why you get better outcomes. Is plant-based vitamin C isn't vitamin C. It's vitamin C with rutin, hesperin. Directionally right?
Absolutely.
Tell me about quercetin. Should I be taking even more or less? Should we all be taking it? What should we do if we get sick?
I think I like your numbers that you came up with. I think we know it's one of these things that helps our bodies to fight off infections, including viruses, better. We don't know what the best dose is for everybody. So I tend to kind of pick something in the middle for most people. So I like your numbers.
Okay, those are good numbers. Okay, so people are asking about vitamin C. We talked about the drug protocol that worked for your patient. Let's see, IV vitamin C, that's a different animal because most people can't get that right now. So
they can't get vitamin C?
They can't get IV vitamin C just because it's not available. You know, you can't get it in the hospital. And if you're lucky enough to have a doctor like you hanging around, but you're not even doing IVs in your practice because of masks and availability, right? It's considered an optional practice. And
I'm hoping that I've ordered from 2 different companies a kit that we can check the immunoglobulins, so the antibodies to the coronavirus. So I'm hoping that we'll have a test that we can, like a 5-minute test coming in next week or the week after, so that we can have people run to the car, do a little finger prick, see if they're actively fighting it or if they're immune, and then know safely that it's safe for them to come into the office so that the patients aren't exposing each other, they're not exposing my staff, so that we can give IV safely again.
Yeah, the Upgrade Labs clinics in LA got shut down by the government. So, I mean, heaven forbid during an outbreak that people might want IV therapies that make them more resilient.
So one of I do them for my staff though, because we had ordered a bunch, wasn't quite thinking through how this social isolation was going to work yet. And I was thinking, I need to stock up on IV things because this will help people so much. So I've got some IV supplies, and I'm like, let's use them. Let's do them on the staff so we can all stay healthy. And then my staff they're containing themselves with their families, so we have minimal outside. Oh, look at you.
So my peptides are in there, and my IV supplies, if you guys can see them, are in there. So yeah, I'm down with the IVs, but most of us don't have the ability to get IVs in our refrigerators like that. So if you don't have it, oral. Take your vitamin C. You could still order vitamin C on Amazon. People ask about green tea.
Oh, green tea is a great antiviral. So yeah, you can drink your matcha, or you can take green tea capsules. The ECGC is really a great thing to add in to
Naomi Whittle just joined, says I'm missing milk. Naomi's been on the show a couple times. You know Naomi, right?
Oh, hi Naomi. Oh, I miss you.
That's so funny.
So many people don't have access to many of these, even the upgrade things that you do, but I want to reassure people that a lot of these basic things can really help to reduce the risk for getting the severe disease. And then if they get the severe disease, they can go to my blog at shippymd.com, and there's more information about what that protocol is, but then just how you eat. And whether you're meditating and sleep, prioritizing sleep is so important. And I love it that things like celery, onions, garlic. So I've been making this turmeric and ginger tea, like really super concentrated, just chopping up the roots and boiling it and adding a little bit of lemon juice to it. I think those things are so powerful.
I keep hearing this, like, flatten the curve by hiding at home. That's actually a bunch of crap. The way you flatten the curve is when you do get it, which you are going to get it, even if we all go back to work in 6 months, you'll probably get it then. Just be well enough that when you get it, you're home for a week and you don't have to go to the hospital. So it's not about, oh my God, if anyone gets sick, they're going to go. No, just don't be average, because the average numbers aren't that high. So the stuff that Anne just shared with you is about how to be unaverage, how to be abnormal. And if you're abnormal, you are very likely to get it, just no matter what. You're just likely to walk away. We have people in our neighborhood, we have local kids. You just had a patient who had to go to the hospital and survived and turned around very quickly. And so this is probably going to happen. So now's your chance. You have probably a couple of months when everyone isn't going to work and everyone's staying home. So quit eating crap, drop the fried food, drop the sugar, do what Ann said, drink your ginger turmeric tea, crank up your zinc, crank up your vitamin C, do all the stuff you can learn about. It's not even very expensive. Zinc and vitamin C are both quite expensive.
Yeah, most people can definitely afford to be on those things. Yeah. And the vitamin D, melatonin, or other inexpensive supplements that can really help. And meditation is free.
So it's totally free. And you've just shared a bunch of stuff. You have some stuff on your blog. David Sinclair from Harvard was on yesterday on Instagram Live. The podcast with him is going live within the next, I think, 24 hours on Bulletproof Radio and iTunes, where we go through a similar set of questions, like what's he doing? Good thing is there's a lot of alignment with what you just heard here. And David Perlmutter, I think, just went live today as well. So I'm prioritizing anytime I get someone who knows a lot, either I do an Instagram Live right now, because you have breaking news about, hey, I had a patient, hospital wouldn't treat, here's what worked. I want people to get this from a real doctor as it's happening. And then I'm putting the podcast out a little bit more frequently than normal, as long as they're relevant and topical for this stuff. All right.
Dave. Yeah, so my patient is at home now, and he's not requiring any oxygen, and he really is recovering beautifully so far. I'm just couldn't be more pleased. It's I think it gives us some hope that we're going to have a treatment that will work for most people, especially if they're doing what we're talking about to get their bodies as strong as possible. But I do have to say, I really do want people to stay home right now, because there's so many people that if they do get this, the hospital systems are going to be overwhelmed, like they are in Italy and Spain and France. They're over there, they're seeing 500 to 800 deaths a day. I talked to a friend of mine that is really well connected in France, that it was very sobering. I just really, and the thing that seems to be making a difference is staying home and not getting out. I also heard a rumor that maybe China is back to social isolation as well. That'll be interesting to follow and see if there's some truth to that.
I'm seeing some comments here saying we're overwhelmed with some of the hospitals here as well. One other piece of advice that is worth noting, I see the Betty Rockers on here, Bree. If you guys are looking for exercise stuff to do at home, I have the hottest ass after doing her workouts. It's incredible. Okay, just kidding. But like maybe Lana does. But I will say those are some seriously good home workouts. So Betty Rocker, thanks for logging in. You're awesome. And there's Rachel Varga, who's been on the show as well up here on the island, who does, she's probably staying at home because she also does elective treatment. So anyone who wants elective stuff, including dentist work, unless you have a tooth that's completely shattered, you're probably not going to go do any of that for a while. So on that front, take care, be cautious, and you might have some time at home. Don't climb the wobbly ladder carrying the chainsaw right now, because you do not want to be in an emergency room for any reason. So don't do crazy stuff.
Well, it's really interesting too for people to just even get their primary care that they need, or minor urgent care. It's really disturbing that one of my staff's mothers has a heart condition, and she's just trying to get to be seen to evaluate, is this coronavirus or is it her heart? So it's really, really complicated, people just getting the basic medical care. So definitely be careful.
Yeah. On that note, and love your work, love you, thank you. You're a dear friend, and you're doing such good work on people with mold and metals and the hard stuff that requires a unique kind of medical mind. So thanks for sharing with everybody. And you guys remember, if you're already on the good stuff, bring it with you. If you have to go to the hospital, sneak your bag of vitamins in. If you have a cooperative people, you can tell them, but honestly, maybe you shouldn't. That's something you have to sort out for yourself. But if you're with a doctor who's going to say, don't take anything because there's no studies, the answer is, well, actually, there are studies of vitamin C. They just weren't with whatever cocktail you're doing. But if you're giving me IV fluids and hoping I don't need a respirator, I'll take my vitamin C, thank you. You can either fight it, that you might be not in the mood to fight. You might just want to take it. And when they leave the room, you take your vitamin C. That's what I would do. Only
and your
you
zinc.
know for you.
Have zinc.
Thank you.
You have to have zinc to do this virus, yeah.
Okay. I will see all of you later, and good night. And be safe in Austin. Be safe wherever the heck you guys are. Stay home and cook something good for dinner. Bye.